Okay, let's go ahead and get started. Good evening, everyone, and welcome to our Multifaith Medicare for All Forum. I'm guessing that folks who have tuned in this evening are already aware of the big picture here, but we have 29 million people in this country who don't have health insurance at all. We've got tens of millions of other folks who are underinsured, meaning that they've got copays and deductibles that mean that they can't afford the care they need, which means people are not filling prescriptions. They're cutting pills in half. They're not going to their doctor's appointment. And folks who don't get their insulin, don't get their asthma inhalers, they're in pain, they're suffering, and sometimes the outcomes are even worse than a trip to the emergency room. So it's probably not surprising that the exit polling from this last election showed that the winner of the national election was Medicare for All. 72% of the people who voted said they support a Medicare for All program, which obviously means that there is a cross section of folks from different political parties and all kinds of backgrounds who support that, which is so exciting tonight that we can hear from our panelists to talk about a multi-faith perspective on healthcare. My name is Fran Quigley. I'm your moderator this evening. I teach at Indiana University McKinney School of Law. I direct the Health and Human Rights Clinic there. And I am proud to be a member of both of the sponsoring organizations for tonight's conversation, the Central Indiana Democratic Socialists of America, the Religion and Socialism Committee, and also the Indianapolis chapter of Medicare for All Indiana. I want to give a special shout out and thank you to the folks who put this evening together, Jesse Brown, Michelle O'Connor, Dr. AJ Sinha, and Barry Levitt, and all the other folks who worked hard behind the scenes to make this happen. And a special thank you to our panelists. You can put questions to our panelists. There's going to be a Q&A slot there at the bottom of your screen. And as time permits, we're going to share as many of those questions with our panelists as we can. And we're going to provide you with some poll questions, some resources to learn more, and some contact information for our sponsoring organizations. So let's get right to hearing from our panelists, who we are so grateful to have them join us this evening. I'm going to briefly introduce them, and then they'll take turns responding to some questions that I'll pose, and hopefully we'll have some time for questions from you all as well. So our panelists are Reverend David W. Greene, Sr., who is the pastor of Purpose of Life Ministries, and he is also the president of Concerned Clergy of Indianapolis. Rabbi Jordana Chernow-Reader from the Indianapolis Hebrew Congregation. Hebah Kassem, who is a Muslim Medicare for All activist and a member of the DSA and part of the Congressional Progressive Caucus Center and Action Fund. And Father Charles Allen, who's an Episcopal priest and, like me, a member of the Religion and Socialism Committee here at the Central Indiana DSA. So we've discussed this before, and Reverend Greene is going to do the honors of responding first. The first question for our panelists is this. Could you start with sharing what your faith's scriptures and traditions have to say about what our moral obligation is in response to the suffering going on all around us of people who can't get access to the health care they need? Oh, I think you're still muted, Reverend Greene.
Sorry about that. Good evening, everyone. First, I want to thank our sponsors, our moderator, and the other panelists for allowing me to join you for this important discussion that we're having tonight. I begin with our healthcare system is clearly under attack. It created a great deal of havoc when you look at people who are unemployed, underemployed, when we consider people who are poor, especially people of color. COVID-19 has exposed the racial inequities that have existed for decades now in our healthcare system. And this is almost has been accepted as a normal when it shouldn't be. As a person of color, the healthcare inequities are alarming to me, as Black and brown people are 6 times more likely to die of our current virus, COVID-19. The racial disparities are alarming, and without healthcare for all, these disparities will not change. As part of the Christian faith, we believe and know that healthcare is something that is necessary and should be experienced by all. Why? Because we believe in love, compassion, mercy, and that's something that should be experienced and made available to all people. The scriptures for that, there's numerous scriptures in the Old Testament and in the New Testament. In the Old Testament, we have stuff A verse like from Micah, the prophet, who said to act justly, to love mercy, to walk humbly with our God. Or Jesus himself told us, love ye one another. We've got to love one another. And love is an action word. That's how we are to be recognized with Christ, is that we love one another. And so healthcare is something shouldn't be a pipe dream. It's something that should be real because of the compassion and love we have for all humans, especially the poor, the unemployed and the underemployed low-wage workers that we've deemed essential employees as a part of this pandemic. They need to have quality health care, paid sick days. They need to be more than just recognized or patted on the back for their sacrifices. They need quality health care. And Christians understand that we have a moral obligation to help them be able to receive those benefits.
Thank you, Reverend Greene. Rabbi Chernow-Reader, what about the Jewish tradition?
Absolutely, and thank you everyone for being here tonight. As the Reverend said, there are many references in what I call the Bible that really does illustrate this point. And to me, one of the first things that came to mind is that throughout the Torah, there's all these lines about leaving the four corners of the field open for the widow and the stranger and the orphan, and really that to me is all about taking care of the people in the community who are in need. And often when I'm teaching this text, I think about so what is our equivalent today? How can we most of us are not farmers anymore. Most of us don't have literal fields that we can leave open for people, but there are other structures in place, and there should be other structures in place for us to help and care for the community, especially those most vulnerable. And often people are vulnerable because of health needs or become vulnerable due to a health need. All the more important is for us to put those structures and those benefits and those things in place so everyone can be looked after at all stages of their lives.
Wonderful. Thank you so much, Rabbi. Ms. Kassem, what about what is the Islamic traditions here?
Good evening. First, I want to say thank you to the organizers and the panelists for this incredible event. So I'd like to start off and echo what Reverend David Greene said about COVID-19 and the disproportionate impact it has had on communities of color and low-income communities. Healthcare is something that I have always been passionate about, and COVID-19 has made a stronger case as to why we need Medicare-for-All. In the foundation of Islam, there's an obligation to ensure that everyone's basic needs are met. And one of the 5 pillars of Islam is zakat, which means to give charity. And that actually goes beyond charity and requires Muslims of means to contribute a significant share of their wealth for those in need. And as we know, insurance companies are not doing that. They are not sharing their wealth. Additionally, the teachings of the Quran and the sayings of the Prophet Muhammad insist that medical practitioners serve all of mankind, poor or rich, literate or illiterate, Muslim or non-Muslim, Black or white, with patience and tolerance, with virtue and reverence, with knowledge and vigilance. And a well-renowned Islamic scholar, Imam Ghazali, interpreted these teachings and deemed that healthcare is a fard kafiyah, which means that it is an obligation on an entire community to ensure equal access to healthcare. And so one could argue that under Islam, there is a moral obligation to ensure all people get the healthcare they need.
Thank you so much, Ms. Kassem. Father Allen, what about the Episcopal tradition?
Well, I could start off with saying what everybody else said. I mean, we share a lot of, we read one another's scriptures. Certainly, again, in our tradition is that, actually in some ways, St. Paul, even though sometimes he's considered a bit of a conservative, he could at times be more radical. He actually said that the way to love God is to love your neighbor. Of course, we get that from Jesus too. Jesus is quoting Leviticus, and it's interesting when you read that chapter, because there's a parallel saying, it's not just loving your neighbor as yourself, it's also loving the foreigner, treating the foreigner as one of your own. So it is love for both your neighbor and those beyond your borders. I think too, in the Episcopal Church, we always talk about a three-legged stool. Every stand we take is based on scripture, tradition, and reason. And all of these have to sort of, I mean, we consult all of these when we're figuring out where to take a stand. And it's on that basis that we see healthcare for all as an obligation we should be working towards. It's one of the things we do at certain festivals every year. And when there's a baptism, and also at certain festivals, we renew our baptismal vows. And our baptismal vows are both about loving our neighbors as ourselves, but also to seek justice and peace, to work for justice and peace among all people, and to respect the dignity of every human person. So these are all things that would, and I think, you know, in 2009, we did, our church as a whole did already endorse individual payer healthcare in whatever form it takes. With the phrase Medicare-for-All wasn't so current back then, but that is the official stance of our church.
Thank you, Father Charles. Single payer healthcare, correct? Is that,
single payer, thank you.
Yeah, no, thank you. That's wonderful. So hopefully, and my expectation, I think, is that this is going to be a theme. We're going to have a lot of agreements, but from different rich traditions and scriptures. So Rabbi Chernow-Reader, let me ask you the next question, but let me say this first for the folks who are joining us. Again, the bottom of your screen, there's a Q&A box. You should be able to pose questions yourself in that Q&A box, and our panelists stand ready to field your questions. Not just me, although I want to ask the questions for the whole hour. I promise to leave some ability for others and not hog all the questions that I have. So Rabbi Chernow-Reader, we do hear, as Father Allen told us, you know, that this common theme of loving our neighbor across all the traditions. But there are some people who will say that that obligation is just an individual one. We should just individually do charity. We should make the commitments that we can do ourselves. But do you see in the Jewish tradition any kind of communal obligation, especially in context of healthcare for us as a community, you know, as a government, which represents us, to actually do something about this massive crisis we have?
Sure. And first of all, I have to say that is one of my favorite quotes. This idea of loving our neighbor as ourselves, I just put it into one of my sermons a week ago. So it really is one of my favorite go-to texts to teach. So thank you for bringing that into this conversation. For sure, Judaism is very much a very communal religion, very much so. You know, not only as the one I referenced already about leaving the four corners of the field, which is throughout our text and other similar texts along the ilk as well, but there's also one of our very, very highest values is this idea of pikuach nefesh, which is about saving a life. And often to save a life, that is through taking care of each other. You know, it's one of the things, like, you know, we at IHC, we've been very careful about doing a lot of online program. We haven't had anything in person. And when we are in person, we're all masked. And that was partly for us protecting the community through our own actions and, you know, being responsible about ourselves and hoping to model that for other people as well. So, you know, on the individual scale, we are very much responsible for each other, but we are also all responsible for each other on the communal level. You know, we have sayings about how we are all responsible for one another. And that really is trying to cut through some of the individualism and focus back on the fact that we are all a community, and the healthier everyone is, the better it is for everyone. The more all of us are educated and have access to the basic things that we need, the better it is for everyone. The more community shines, the more the community shines. I don't think it's about, siphoning off the resources. It's about giving them to as many people and celebrating the growth of everybody as much as possible. So I think that is very much deeply rooted in the Jewish tradition, that we very, very much value community, and not just community being ourselves, but community writ large, and making sure that we are all taken care of and have access to all of the things that we need as much as possible.
Thank you, Rabbi. What could be more demonstrative of that point is an infectious disease, right? When our neighbors are sick, whether we're out of just compassion or pure survival, we need to care about whether our neighbors are getting the care they need. Before I let you log off completely, can I ask you this idea of communal obligation? And I think there's a question already in the chat about advocacy. The Reformed tradition does have an advocacy group in DC. Can you share a little bit about what kind of direct advocacy is done in your tradition?
Absolutely. We have a very deep and long tradition of advocacy. The prophets, so many of them, a few of which have been quoted already, have always been advocates for what they thought was important. So that is deeply, deeply rooted in our tradition. And often as rabbis, we walk the line of where and when to advocate. That is definitely deeply ingrained in our tradition. But there is, to answer your question, there's something called the Religious Action Center, which is part of the Union for Reform Judaism, which is kind of our overarching organization. And the Religious Action Center, or the RAC as we call it, they do a lot of political advocacy and have done for literally decades. They work on many, many important bills, work on many, many very, very critical issues. They both work it on a state level and a federal level. I spent 5 years living in Ohio, and there was something called the Religious Action Center Ohio. So not only are we working on large federal issues, but also on local issues as well. And that is one thing I think that we have learned in recent elections, is that the local advocacy is also very, very important and not to be overlooked. So yes, that is deeply, deeply ingrained in our tradition, and continues, I hope, for long, long into the future.
Thank you so much, Rabbi. Ms. Kassem, you literally, your day job is to be an advocate, and that's not just your profession, but also what you say what your faith calls you to do. Could you explain a little bit about how Islam calls for you to be that kind of advocate, and other Muslims to be that kind of an advocate?
Mm-hmm. So similar to Judaism, we also do have a communal obligation to provide care for those in need. And like you said, my day job is to be an advocate. And I feel like for me, my faith has shaped so much of who I am in like my career. And growing up, I didn't realize it. And when I started doing the work that I did, I didn't realize how much of an influence my faith had on me to be an advocate. So I have dedicated my career to fighting for healthcare. I'm very passionate about healthcare. And in Islam, we are taught, the foundations of Islam are to give and to ensure that people have equal rights. And for me, it was just kind of second nature. So I'm very grateful to be a part of the faith, and I'm grateful to my family and to be here in DC now fighting for healthcare for everyone, especially during a time like this. I'm sorry, Frank, can you just repeat the question?
I think that you answered. If
Okay.
I could put a little bit more of a point on it, this conversation that you and I have had before. There are an awful lot of folks in our healthcare professions in the U.S. who are Muslim, and they have come together as advocates as well. Could you share a little bit about what Muslim healthcare providers are doing out there?
Yes. So one thing that I have deep appreciation for are these free health clinics that have been established by Muslim, not just physicians, but Muslim healthcare professionals across the nation. And they've come together and they've established these free healthcare clinics, not just for other Muslims, but for everyone, for anyone who needs health insurance or who needs healthcare. And Fran, as you had mentioned, I think you said 27 million people are uninsured. At the start of the pandemic, it was 87 million were uninsured and underinsured. And since then, that number has grown. And I think that these free clinics that are run by Muslims across the country are very critical during a time like this, because where are people supposed to turn if they don't have health insurance? And, you know, we're in the middle of a global pandemic. So yeah, I'm very grateful to a lot the advocates across the nation, not just Muslims, but people of all faiths who are coming together and supporting people during these difficult times.
And I'll give a special shout out to American Muslim health professionals who have done just what you said, Hebah. They have, you know, they're seeing this firsthand, and so their testimony, if you will, is so powerful, because they're seeing the folks come to them who can't afford their care, and can say, we're trying to do what we can to do direct service, but we need to fix the overall system. That's powerful stuff. Father Charles, what about the communal perspective from your tradition?
Well, I mean, in a sense, we're kind of hyper-communal especially among, you know, we don't like to even be classified as Protestant. We sort of straddle the fence between Catholic and Protestant. So we understand all of our life to be communal. You know, we've taken it to the point that, you know, we don't do private baptisms anymore. If you're going to do a baptism, it needs to be with the worshiping community. And I mean, Christianity started out that way. After all, one of the first experiments in socialism that we know of is in the community in Jerusalem in the book of Acts, where, I mean, but yeah, the idea that we just don't see faith as a private matter. In terms of how we relate to the government with that, we relate to the government the way any body of conscience relates to the government. We believe that there are common truths and common goods that all of us can recognize, and all of us can debate about what they are too. I'm not saying everybody already agrees with what they are, but that these are things that I don't have a right to simply quote my religious text and tell people they have to do what my text says. But when that text motivates me to talk to people and to convince them based on what either their traditions say or what the common sense we have and our sense of the common good that we have, and to appeal to that and to work collaboratively, not just with people of faith, but with all people of conscience and goodwill.
Reverend Greene.
I agree a lot with Father Allen, and I would just add, you know, from the Christian perspective, we see it as communal. We see it as a mandate to advocate for all people and not support except the greed of a few. So we really want to see all people, and we see it as the church's responsibility, because we see it as God's not concerned about our building as much as he's concerned about our building people. He's concerned about what we've done for the least of those. So it's important that we do this from a church community perspective. And in particular, from a Black church perspective, many of its leaders have always had a social justice lens that they would look through with various texts. So they didn't just, you know, they didn't just exposit the text or exegete the text from one lens, but one of the important lenses they would use was social justice. So they could look and say, Jesus is upset, turning over the tables. Here's why he's turning over the tables. And this is where we need to be involved as a community, not as an individual, but as a community and as a whole. So, because within the Black church perspective, you see the civil rights movement, et cetera, issues that were germane, that were communal based, not individual based.
Thank you, Reverend Greene. And maybe I can ask you to share just a little bit about a real tangible application of that I was fortunate enough to witness when Concerned Clergy of Indianapolis, under your leadership, and the Baptist Ministers Alliance, which is in Indianapolis, an urban-based coalition, came together with a rural coalition in southern Indiana. Folks from a completely different part of our state, but came together on the healthcare issue to resist our governor's plans to really restrict our Obamacare expansion, what we call Healthy Indiana plan in our state. You know, how did you find common ground with that coalition?
Again, I mean, when it comes to those type of issues, when it's involving people, because it's easy, especially within the minority community, to say we need to be working together, regardless of where somebody's from. This is about all people, and we can have different backgrounds, but we need to work together on this issue that impacts the lives of individuals. So you can put aside rural, urban, you know, age differences, all the race differences, and say this is about people and we need to do the right thing. And it's something that you just practice, and it has to be in your spirit. If we're going to be successful with when you're trying to overcome money and power, we need to be together.
And if I could just add the postscript, that was very successful. The plans by Indiana were completely abandoned, and made national news and national attention because of folks coming together and finding that common ground. So again, the power of coalitions, sometimes interfaith, sometimes multi-faith, sometimes across different geographic areas as well. So Ms. Kassem, Hebah, I'll start with you, and I think you're the right person to start with on this next question too, because it's about kind of how we do this. If we have a consensus that we do need to ensure that our sisters and brothers get access to the medicines and care they need, if we have that across our faith traditions, you know, how do we accomplish it? Some folks believe that we need, again, our sponsored organizations believe in a Medicare-for-All system, a single payer government system. Some folks think, well, we can do this with for-profit insurance companies, which you've referenced as well. What's your perspective on this, and how does your faith intersect with your perspective on that question?
So obviously I do this for a living, and so a part of my job is to look into the private insurance companies and what's happening. And I just don't know how we could achieve universal health care or a single payer health system while keeping private insurance companies. The goal for private insurers are to make profit. That is their main goal. Their goal is not to ensure that people have the healthcare that they need and get the services that they need in general. So if their main goal is to make money, I just don't know how we could achieve universal care when they just want to make more money. And during this pandemic, when more than 87 million people are uninsured and underinsured, private insurance companies had record high for profits. While people are suffering, unable to access care, they made more money. And with the way things are now and after the election, you know, for people who are fighting for a single payer health system, we still have a long way to go. We still have a fight. And I'm not against working on a plan that will get us there eventually, but I just don't see how having private insurance companies I just don't see how we can achieve healthcare. And when talking about Islam as a faith, you know, one of the foundations is the redistribution of wealth, and it goes against Islam to profit off of the people who are suffering. And that is exactly what private insurance companies do. They profit off of the suffering of people. So personally, and as a Muslim and as an advocate, I understand and recognize that they exist, and this is a system that we have, and we have to work towards universal healthcare. But I personally believe that we need to eliminate the insurance companies because their goal is to make profits, and Unless we remove that, we just can't ensure that everyone will get the healthcare that they need. So, yeah.
Thank you very much. And I think if I might have lost track of my sequence, but I think it's Father Allen's turn. And if I may ask you, Father Allen, if you could share with folks the anecdote of when you had the local, you told me the story of when you had the local vote on the Episcopal Church's position on a Medicare for all type system.
Yeah, that again, that was back in 2009. One of the things that often happens is when our national church convention passes a resolution, we are often asked to pass the same resolution in each diocese. So this resolution came up in our diocese too. Our bishop back then was Bishop Catherine Wainick. And what I recall was that, I mean, the discussion about it was pretty favorable. And she said toward the end, she said, I think this is one of those occasions where instead of simply voting aye or nay, that if we're going to vote yes, I want us to say hell yes. So that's what we did.
And again, these are tough conversations, and I appreciate the explanation, because many of us are on this call from Indiana. Indiana, we have our neighbors and sometimes congregants who work for. We got a big insurance company, we got a big drug company in our community. So it's not talking about those individuals, but whether, as Hebah said, whether we can have a system that covers everyone when there's still that profit motive in the middle. So Reverend Greene, what's your perspective on this?
Well, the Christian faith tradition I'm a part of wants a single payer government healthcare system that ensures care for all. We join with the majority of Americans who want a full public healthcare system that eliminates the profit making that Hebah has just talked about. We want to, eliminate the deductibles and make sure the coverage is there. I reduce it down to a simple analogy as, we follow Jesus's example, and Jesus healed leprosy, he healed other diseases, but he never charged a copay. He didn't do that. So we want to take responsibility for the poor. We think it should be about the poor and not about profits. We need to be and follow the model that Jesus set, and we can't succumb to the pressure of profits or to the pressure of big businesses. Frederick Douglass once said, you can't love the Christianity of Christ and embrace the religion of the slave master. To love one is to hate the other.
Thank you, Reverend Greene. Rabbi Chernow-Reader.
Sure, thank you. I think for us, it's one of the biggest things. It's really just about this idea of caring for the community, that we are all responsible for each other, and also empowering people to take care of themselves. There's that famous story about how you can, get a person a fish, but if you teach the person to fish, then they are able to sustain themselves and to be able to really care for themselves long into the future. And that really is one of our goals from the Jewish perspective. And also from the healthcare perspective, I'd love to see also just a bigger emphasis on preventative care and catching those things early on and give people incentives for doing the things that will sustain them in a healthy way for the long term. So that is one of the things that I would also really love to see be more of a bigger emphasis healthcare wise, ensuring that everyone can really take care of themselves to the best of their ability and try to head off the things that could be more damaging to them in the long term. But really, again, just this goal that we are all responsible for one another.
Thank you very much, Rabbi. And absolutely. And of course, the studies, the data from other countries and our own show that when people are not covered, when they don't have good health insurance, they skip the primary care, right? They don't go to skip the preventative care, and then things get really bad, and they suffer, their families suffer, but also it's expensive. It's just not the right way to do things. There's a theme in the questions that we're getting, which if I can paraphrase it, is that this is wonderful that we have such consensus, and I think that the folks on this call are pretty disproportionately activists, right? So it's wonderful to have this faith consensus that things need to change. But how do we do it? We have 72% popular support for a Medicare-for-All type system, but we don't have a Medicare-for-All type system. Communities of faith are so powerful in this country, but these positions that we see uniformly held here are not the law. So I think that if we start, I think it'll be with Father Allen to start with. How do we translate these good intentions, these scriptural mandates, into real tangible change? That's a big one, sorry. But I will say, you've got, while you think about it, you've got the most spiritual backdrop of any of us, right? You actually look like that you're at an altar almost. So.
Well, I mean, that is a tall order. How do you get from point A to point B when there is so much opposition and so much disinformation about what we're even striving for? I mean, one of the things I was thinking about, again, I don't have the universal answer for this, but one of the things we need to remember is you can't just wait every 4 years and focus on national elections. And even, I mean, yeah, first of all, we need to focus a lot more on local politics and on getting representation at a local level. Because when we forget about that, then things are never going to happen in Washington, D.C. either. And also, I think actually I'm preaching to the choir here. We need to realize that voting is a very crucial, but also it's just one part of what political engagement is. So much of what we do is finding ways to stay visible and to be a voice that can't be ignored. And I was so inspired a few years ago at another election where I was utterly dismayed. But the next day we had a meeting with some union organizers. And we thought that, I mean, we were going to be going ahead with this meeting and with this union organizing, regardless of who had gotten elected. And even though the person I had voted for had not been elected, we realized we still had the same work cut out for us. You can't just count on whoever the president is to make this happen for us. We can't just count on our Congress people to do this for us. We have to do so much of this ourselves. We have to organize. And I'm pretty bad at it, but I'm pretty easy to drag into it when other people take the initiative.
If I could slightly disagree with you, I think that Father Allen, you have for many years in our community been an advocate for, as you say, union workers, but union workers in our most marginalized sector, right? The food service workers, folks in janitorial services, et cetera. And can you share a little bit? Those are folks that they do struggle with access to healthcare. It's one of the big issues that they advocate around. Is that correct?
That is correct. Usually without a union, the healthcare insurance is unaffordable. They may offer, the employers may offer something, but it doesn't cover much of anything. And the premiums are I could not live on it. I really couldn't. And one of the first benefits that, you can always be, unions and like all organizations, they're not perfect answers to anything, but they provide a safe space where workers can actually talk about their working conditions with their employers without fear of being fired, where workers have to be treated with respect, and where things like you actually do get, I've heard one after another talk about once they got the union in their company, they actually had health insurance and they could actually go to the doctor. They could do this preventive care.
Thank you very much. Reverend Greene.
Obviously, I don't have the silver bullet, but I do believe that across all of the different faiths, there needs to be more of a commitment to genuine conversations, keeping this at the forefront of the organizations to address the issue. I think too often it gets limited to we do a single event for quote unquote poor people, when it needs to be what can we do continuously and sustain it, so that, yeah, it's not something that's discussed once every 4 years, but it's consistent. And I believe as leaders within our different faith organizations, we have to be committed to keeping this at the forefront, because it's about poor people. And there are millions of people that fall in this that are uninsured, that don't have insurance. And we need to remind ourselves and our congregations every chance we get, so that this is important. Because when we do that, we address what somebody views as important. When we want to address it, we can address it. We just demonstrated it by, we're going to find a vaccine for the coronavirus in record time. We can do it. It just needs to be something that is sustainable, that we stay focused on it, versus we've let that slide to the back of our minds or down the priority scale, and then we got to restart again. And it takes something almost drastic to happen to break it up to number one. And then can we get across the finish line before it becomes priority 5 or 6? And I think that continues to be a challenge. And I think, and from all our faith traditions, if we can find ways to keep it at the forefront, remind people how important it is to address this need. Because when the people at the top who are rich and greedy, obviously they're not going to come up with the solution. I mean, it comes from people who have a compassion and concern to say, we have to do this. We have to push it that way. You can't expect corporate people who have a lot of stock and making a lot of money to want to drive this, because that's not going to happen. Greed's going to be in the way.
And there was a question in the chat or the Q&A that I think that you've all addressed a little bit, but if I could I'll put on my law professor hat and address a little bit more specifically. It's how can faith communities be advocates like this? And the limitations are that at a faith community, the example is that you shouldn't from the pulpit say vote for this person or don't vote for that person. It's the electoral politics limitation. But faith communities absolutely can and do come together in coalition with other organizations and with the community on issues. And Reverend Greene's Concerned Clergy, which is the longest standing and the most respected civil rights organization in our community, has for decades now, for half a century now, right? Stood up on issues of housing and economic justice and policing reform, et cetera, and in a very political way. And has had an enormous impact and has done that from a grounding of a faith tradition. So there's definitely faith communities can and do take real tangible action on issues like this without any running afoul of the IRS. You can take that lawyering advice for everything that you paid for. Rabbi Chernow-Reader, about the advocacy piece and how we get from these good intentions and these scriptural mandates to really making change.
Sure. I mean, I think, my answer is very similar to the ones that we've heard. But I think it's important for us to remember that we do have power, and especially when we are aligned. There are issues that divide us, and I think so often we can divide ourselves or subdivide ourselves into these little tiny groups, and we feel like we need to be aligned on every single issue to cooperate together. But I think that this panel shows that we all come from different backgrounds, but we are all agreed on these issues, and there are so many big picture issues that we do agree upon. And I think remember that we can join together, we can have organizations like the one that Reverend Greene runs, and that we can when we join together, when we stand together, when we advocate together, then there is strength, and there really is strength and power, and we can make a difference. So I know sometimes there's this great quote that says, we're not obligated to finish the task, but we are not exempt from starting it either. And I think that especially in social justice work, that is definitely one that I live by, that it can feel so overwhelming and we might not be able to solve the whole thing. But if we get a little bit closer or move the bar a little bit or make a little bit of a difference, then that can be a huge impact on the people's lives that are affected by it.
Thank you so much, Rabbi. There's, again, to kind of continue a little bit on this theme, but maybe drill down a little, because we do have several questions in the chat about this. And I think it reflects that many of us are living in a red state, right? A state that just, voted for Republicans for at every level. So, how do we as faith communities address the fear mongering out there that this is, big government, it's going to take away your choices, there's going to be death panels and all those things. And so, Hebah, since this is your day job and you do work on the policy more deeply than any of us, if you could start off, what are the answers to that kind of, as I think Reverend Greene and Father Allen and Rabbi Chernow-Reader have said, there's a lot of very moneyed interests that are putting out arguments against change. What's the argument, or what's the response to that?
Sorry, there are helicopters in the area, so sorry if you hear that in the background. So I work within the Medicare-for-All coalition at the national level, and we have a number of resources on this. And I will start off by saying that we do pay a lot for our healthcare system that we have currently. So we actually do pay out of our taxes now. And for people who have Medicare, a colleague of mine is actually, she's been struggling with the Medicare that her mother has during COVID because it's tied to private insurance companies. So even the government plan that we have, private insurance companies are profiting off of that. So this whole, I guess, argument or fear that the government is going to come in and take control, we are already paying for private health insurance companies. Our tax dollars are going to their profits, and our people, low-income communities, communities of color, and even workers without unions are suffering. So we're paying for the suffering. Essentially, that is what is happening. And I wanted to say this earlier when I saw it in the chat, something that we can do and something that all of the panelists mentioned is organize. And it's very critical to organize at the local level. And we have, and I can share resources, there's an effort by Public Citizen, a national group, for passing local resolutions on Medicare-for-All. And I'm happy to share the website, and they have a number of resources on this. And I think it would be great if people at the local level, and this could be done in red states, get involved and organize around these local resolutions. And cities and counties across the nation are passing local resolutions saying they support Medicare-for-All. Also, even for the red states and people who have a different political view, Fran, you had mentioned at the beginning of this that Medicare-for-All won during this election, and the polling is showing, it was actually a conservative poll that showed, the conservative national poll that showed that the majority of Americans support Medicare-for-All. 72% of Americans, whether they are independent, Republicans, or Democrats, are in support of Medicare-for-All. So I think that most people, it's just the way that it's framed, and honestly, the big lobbies, they have the money and they're doing a really good job. That's essentially what it is. So I think if we organize at the local level and we have the right resources and we use a different type of framing, I think more people will come around to a single payer health system. Because like I said, we're already paying for a healthcare system that is not covering everyone. So, and I can drop the link for the Medicare-for-All resolutions.
Thank you. You're way ahead of me on that. Yeah, and those will reference the many studies that show that Medicare-for-All, we pay quite a bit more, as to Hebah's point, we pay quite a bit more for our system now than we would if we got rid of the profit motive in the middle. And in the chat, I'm not sure everybody can see that, but we did have a response that in West Lafayette, Indiana, they have a local resolution that taking advantage of these resources to push a resolution in their own city council. So I
Fran, you're muted.
That's probably sometimes for the best that I get muted, but in this case, I should be heard. Father Allen, what do you think about this this idea of responding to, the counterpoints, the arguments out there that this is going to be, take away our freedoms, take away our the independent free market system?
Well, what's weighing on me so much now these days is, I already said that our church prizes scripture, tradition, and reason. And one of the things that really is getting assaulted these days is reason. I love the information we can supply that corrects people. What is dismaying to me right now is how unwilling people are to even consider evidence or information or studies or, that just what's going on about the people who think that Trump actually won the election I'm just so worried about it. Are we entering a post-truth, post-rationality era? Are we entering an era when we can't actually talk about what well-attested facts are and what well-attested science is telling us? We've got to, I don't know, we've got to do a lot of work about how do you have genuine, reasonable discourse about what is going on in our country and about what these positions really are. I don't know, that's not really answering your question directly. It's basically it's the unease that your question raises for me. I'm doing what I'm a campus chaplain, so I'm working with students. I'm always encouraging to them to say, try peer-reviewed sources. Don't think that a Google search counts as research, or that your Facebook newsfeed counts as that. But we do what we can, and frankly, it's worth praying about.
Amen to that. And it reminds me of the old saying that you are entitled to your own opinion, but you're not entitled to your own facts. But we have an era where people are choosing their own facts, and Facebook and social media are allowing us, right? When we click on a couple of different sites, it's going to only give us others that will reinforce our beliefs, whether they're accurate or not. Rabbi Chernow-Reader, what do you think?
Yeah, similar, and I would say one of the, I know we're veering ever close to 8 o'clock, so I'll make this brief, that I do think that one of our highest Jewish values is to not separate ourselves from our community, but to deeply be immersed in and care for our community. And I think there's many, many ways to do that, but I think one of the biggest ways we can do that is ensure that everyone has their basic needs, including and especially healthcare. So I do hope we can get to a day when all people have what they need and have the healthcare that they need. And hopefully through conversations like this and many more, we can bring us closer to that.
Reverend Greene, you've been an advocate for many years on healthcare issues and some other issues. How do we counteract the false narratives out there?
I think we just have to be diligent in challenging people not to be selfish. We're living in a very selfish time. And information on social media, other platforms, somebody can always give you information to support your fallacy if it's completely false. And so we're going to have to challenge people to say what's best for the whole. And when we do that, then we got to be concerned about all people, not just my personal thing that I enjoy or I have. I've got to be thinking about others. I got to love other people. And if we can, and that's the huge challenge, is to get people to do that. I think we're, it's a period of time where you just wonder. I'm like Father Allen, you just wonder, because people can make anything the truth now. And it's very, very concerning because, you know, they are operating off different facts. They're just making up a fact. And you can start a movement with something you just made up, and it's scary.
Yeah, agreed. Agreed. Well, I want to say that beyond just talk, we are taking action today. Every attendee should see in their poll, and the poll is really very straightforward and simple. Is your faith community already taking action on healthcare justice, on Medicare for all? And are you interested in being engaged with all of the different advocacy that's already going on? So it is 7:57, so I want to be mindful of time. So I'd like to do is give our panelists a chance to, we've commandeered them with our own questions, but if they have something they'd like to say in summing up, let's go around the horn for that. And I think that it will reverse order from our first question. It'll be Father Allen, then Hebah, then Rabbi Chernow-Reader, then Reverend Greene.
With all the anxiety I may have said a few moments ago, let's just take a moment to celebrate what we do have, and that we do have multi-faith coalitions, gatherings, where we actually are coming together to work for common values and the common good.
Wonderful. Ms. Kassem.
Definitely agree with that. And despite a lot of the things that have happened in this country over the last few years, I do have hope, and I am grateful for organizers and activists who are fighting for healthcare and all of these issues for the betterment of this country and all communities. So I'm hopeful, and I want to repeat what was said in the chat and earlier: organize, organize, organize. And I'm forever an organizer. Organize your workplaces, organize your schools, organize as much as possible at the local level. It makes a difference.
I was going to say something really similar, that we have power, and to not forget that we have power. And part of the way we show our power is through organizing, and we have made change through organizing, and to remember that there are so many issues that unite us. And when we focus on that, it can be inspiring and uplifting, and it really can make change. So let's focus on that, and then together we really can do some good.
I just want to say we have to organize. We have to continue to do the fight. Dr. King was right when he said of all the forms of inequality, injustice in health is the most shocking and inhumane. And so we have to make sure our voices are heard.
Well, this is where I miss not being in person, because we'd have to have a rousing round of applause for our panelists. But thank you so much. I'll do it, and I think folks will do it on their own. These are just wonderful sentiments to close with. Thank you, and very inspiring to hear this multi-faith commitment. Very inspiring to hear all these opportunities, and you all gave us a great call to action. We need to go forward and be inspired from tonight. Be inspired by the victories that the faith communities have earned in the past, and know that we've got work to do, and our sisters and brothers are counting on us. So thank you very much to our panelists. Thanks to everyone who attended. Good night, and please be connected to all of our organizations, and let's go forward and let's win this thing. Thank you very much. Good night.